Hysterectomies are a common surgery for gynecological cancers, cancer prevention, or other medical reasons. Hysterectomies can make activity and moving around really challenging. My name is Kelly and I'm a physical therapist and I specialize in oncology, lymphedema, and women's health. And on this channel I share tips and tricks to help manage your side effects and symptoms. And in this specific video I'm going to share a safe and specific exercise routine for after your hysterectomy. Your surgeon is going to place you on specific and personalized restrictions after your surgery. But in general, the recovery period is from 4 to 6 weeks with lifting restrictions. Light movement can help speed up the recovery process, build up the muscles in your back and your core, and help decrease your pain. So what do you do right after surgery? Soon after your surgery, for the first week or two as you recover, you want to start focusing on your deep breathing. The deep breathing is going to allow mobilization of your core muscles again. This is best to do laying down or well supported, as you want to avoid standing for long periods of time. Also, within the first week or two, you want to start doing these specific exercises. The first one you're going to do is a pelvic tilt. Laying on your back with your feet on the ground, thinking about putting your hands on your hips as you guide your pelvis upwards into a tilt position and then gently downwards again, moving nice and slowly back and forth. The last exercises to start are pelvic floor activation or Kegels. Thinking about drawing your pelvic floor muscles up and in. It's best to actually think about drawing in the rectal area versus the vaginal area. Gently pulling your pelvic floor muscles up and in, holding for a few seconds, and then relaxing again, doing about 10 of these. Once you're cleared from your doctor, you want to begin taking short walks again. You can gradually build up, but listen to your body. If anything feels uncomfortable, you want to scale back again. After about 4 to 6 weeks, the goals start to get you doing gentle movement again, so you can get back into your daily routine around your home. You will still want to avoid strenuous exercise or repetitive movements at this time. Start by trying low-impact exercises such as walking or swimming if able. Other exercises that you want to do include trunk rotation with both legs and one at a time. When doing both legs, have your knees bent up together and gently allow them to fall over one way to the side. Feel a mild stretch and gently bring them back into the middle. Then you can fall again the other way and then gently back in. Moving back and forth about 10 times, but making sure that you avoid any pain. When doing a single leg at a time, you want to have your knees bent up and allow one knee to fall out to the side. You will feel a gentle stretch in your pelvic floor, your inner thigh, or your abdomen area, but nothing should be painful. Bringing them back in, and then completing again on the other side. Gently allow your legs to come in and out for about 10 repetitions. The next exercise is a transverse abdominis activation with marching in place. So on your back as you were before, gently activate your transverse abdominis by drawing inwards, making sure that you're not overactivating or holding your breath. While holding that position, your back should be fairly flat and not heavily arched, and you want to begin marching in place without losing that transverse abdominis activation. March in place about 10 to 20 times, focusing on your core engagement. The last exercise that will be great after your hysterectomy, about 4 to 6 weeks out, is bridging. Lying on your back with your knees bent up, gently engage your abdominal muscles. Again, making sure that you don't hold your breath. From there, lift your hips up, leading and squeezing your glute muscles only. Make sure that you don't lead with your back or arch your back up and lose your abdominal activation. From there, after you've squeezed your glutes, you can hold 3 to 5 seconds and then gently come back down. Complete this up and down for up to 10 to 20 reps. After the 12-week mark is when most women will start to get back into their high-impact exercise, such as jogging or aerobics. but make sure that you follow up with your doctor for clearance or guidance for your own specific needs. You want to start slow with your exercise. If you're used to be a runner, start with maybe a 5-minute run, building up about 10% a week or a few minutes at a time. This will help avoid any strain or fatigue in your abdominal or pelvic floor area. If you have any pain, make sure that you scale back and talk to your doctor. If you found this video helpful, please let me know by pressing the like button. And for more videos on oncology, lymphedema, and women's health, be sure to subscribe. Thanks everyone.